Hi, everybody. I'm Dr. Lauren Kosinski, and I'm the founder of Metamorphosis Medicine, and I'm also a surgeon who has 30 years of clinical practice experience, spanning at the beginning from rural solo practice in Alaska to academic subspecialty practice as a colon and rectal surgeon in major urban centers. So today I wanted to talk with you about being a doctor, which is really the concern of metamorphosis medicine, because we learn a lot about what to do as doctors through the course of our training and practice, and people have a lot of opinions about this. But we don't necessarily have the same quality of preparation or attention given to how to be a doctor and how to do that in a way that's sustainable and meaningful to us over the course of a career. And that is my work with metamorphosis medicine. So the topic today is the three pillars of medicine. You're going to recognize these because I'm pretty sure that for you, as for myself and many of the surgeons and physicians who I've spoken with over the last 10 years quite intensively, these are things that we would recognize as being really strong motivations in our career choice and in our practice every day. So let's look into this a little more deeply. I'm going to present first to you this picture of three pillars from Karnak Temple in Luxor, Egypt, because it's a place that I've been. And it's a particular experience and perspective to stand next to something that is thousands upon thousands of years old and of such grandeur that there are things that human beings have been capable of and working on and doing for millennia. And our work in medicine is something like that. So these three pillars include, first of all, intellectual engagement, second, prosperity, and third, soul journey. So I'll say that when I was a teenager and on my own and working, I've had some kind of a job since I was 12, it occurred to me that I would likely be working for most of my life. And at this time, I was bussing tables and cleaning toilets and being a short order cook. One summer, I helped saw down trees and cut them up into logs. So a lot of different kinds of work that people would consider menial labor. And what I realized is that if I could have work that was intellectually engaging, that I had a better chance of enjoying a bigger percentage of my life, and that I wouldn't be somebody who was just going to work every day and waiting for my real life to begin at the end of the workday. And medicine held that promise for me, and it was something I'd already been considering for a long time, but my reasons for choosing it and for pursuing it deepened. I've said prosperity here, which I would say many people today, doctors, would describe as wealth or financial independence. But I want to broaden that domain some, because we can feel prosperity in a lot of different ways, many of which are, and I think in this realm we can talk about them as material comforts, but it could be security, for example, knowing that we have work that we can continue to do, and knowing that there will always be a call for the work that we do. That was a big feature of my choice for this too. And then finally, I've said soul journey. I also use the word numinous. At the beginning of this work, I thought about it as sacred intention, because I really found when I started medical school that a surprising number of people, I would say the majority of people who were my classmates, had some dimension of their calling to this that was about finding meaning through our work and our livelihood, of feeling a wish to make a difference in the world and to be connected with people. And so this is an important element and motivator in what we do, and also a potential reward, right? So these are all things that one friend said, well, this is like the professional trifecta. This is like what everybody wants in their work: a sense of meaning and purpose, a way to be financially secure and to have creature comforts, and then a way to be creative and to be engaged in what we do. So we might ask then why so many physicians are unhappy in our work. And this is a longer question than we can address today, but part of the secret of this, in a way, I think, relates to understanding what these three components are of what called us to the work. So you might find that the image of a confluence of rivers, or in this case, three fjords in Norway, opening into the ocean at the south pole of this diagram, is another way of thinking about this because there is actually a kind of fluid relationship between these three elements. And when there are changes in one, they often result in changes in the other, how much energy flows through them. But we could also look at this kind of, we can also look at this as a river, in this case, the confluence of the Indus and Zanskar rivers in Ladakh. So this is a holy place. And it's also a place where you can see different kinds of water, some with glacial runoff and some running more clear. And of course, I like the vantage point of a dog overlooking this spot and prayer flags. But this idea of a fluid confluence of different components of things that are important to us might work better for you in terms of reasoning through how all of this works for you and for the people that you work with or care about. So we can also look at it as a pie chart. And in this case, we'll just start with the idea that each of these contribute equally to a whole, but that perturbations in one domain or another can cause reciprocal changes in the other domains. And the changes can happen, or the pressures can develop, or inspirations can develop from within the domain or from outside of it. And they can both work to expand our sense of prioritization of that domain or to diminish our prioritization of that, which in many cases people would call being realistic, although I'm not 100% sure that that is actually the case all the time that this is happening. But let's look and see what kinds of things I'm thinking cause these perturbations or influence how we apportion our attention between them. So in the soul journey domain, things like having a patient recover, especially if it was a pretty terrible illness or injury and we thought they might die, it's really a satisfying, elevating experience to have that happen. Or if we also lose a patient but help them to die with dignity and in comfort, that's a good moment. Connecting with our patients when we feel like we've seen them and they've seen us. And this also, by the way, I think contributes to being able to make a good diagnosis and also to plan treatment thoughtfully in ways that work for people so that we get the satisfaction of seeing things work and they get better. When we have experiences of beautiful teamwork where we almost don't have to speak, but we feel like we're all facing in the same direction and we're marshaling the skills that we have, the energy that we have individually to bring about a shared desired end, it's a thing of beauty. Honoring others and being honored. You know, there's that moment, and this relates to the connecting with patients, where we get a look into somebody and we can appreciate something deeply human about them and whatever it is that is brought them into our presence under these circumstances. But likewise, we also feel good when we feel seen and deeply honored and appreciated. Hearing yes. This is one of my favorite things because it's so simple. But if we can go through our day and we hear yes a lot, it's really elevating. It really helps us to feel like it's all worthwhile. And even when somebody might not be able to achieve the yes, hearing somebody say, yes, I understand why that's important to you. I can see that. Let's see what we can do. That's a really different experience, layer by layer by layer, than hearing no. So things that might decrease or diminish our prioritization of the soul journey are things like being disillusioned, feeling that either our treatments are ineffective or that our ability to reach patients is ineffective or the environment that we're practicing in isn't conducive to making these connections. We can feel disillusioned. When irrelevant metrics to the core of what's calling us here to this domain of things are applied, like trying to quantify compassion or to assign a character disorder to people whose compassion is taxed by how we've come to this work and what's happened over the journey, you know, these are things that can cause us to have less confidence in the soul journey domain. And lack of time, when we don't have enough time to spend with people or with ourselves, it's a steady rush of attention to the other domains and not enough time to really explore this internally or externally. So next, let's move over to intellectual engagement. it's really satisfying to solve a diagnostic dilemma. And when we discover something new, whether that's through our own work or through hearing about other people's work at a meeting or reading in a journal or in conversation with a colleague or a mentor, these are times when we're stimulated by what we're experiencing in the medical domain. Also, I would suggest that improvising when necessary. We invested a lot of time learning the fundamentals of the basic sciences that underlie the care that we give in medicine. And also to subscribe to the scientific method, which I will say or academic approach, which most basically is to have a theory, apply your theory in some measured way, look at the outcomes, and make a reassessment of the situation. It's not strictly speaking about doing double-blind randomized controlled trials. It's about an orientation towards life that medicine presents particularly a lot of meaningful opportunities for applying. And finding a better treatment. There are so many things that are ripe for improvement in medicine, and so when we can do this, it's really gratifying. Now, things that can diminish our confidence in medicine as a rewarding place for intellectual engagement are when practice inefficiencies subtract time away from or energy away from what we have to devote to considering patient situations. When we're faced with algorithmic medicine, which has some capacities which are helpful, especially when we're new or we're in a crisis where time matters in a particular way that we don't want to make a mistake or omit a necessary early step. This is really important. But the inadequacies of algorithmic medicine as applied across institutions and things, and also how it shuts down intellectual curiosity, is a problem for us. Documentation requirements that prioritize billing concerns or the capacity for people who are non-physicians to read the chart and to issue a bill, and relegate to the archives almost anything that relates to the physician thought process and details of the patient care that allow physician to physician or care provider to really understand the rationale and background to the care that's being delivered, is problematic for us. Diminished authority, which develops through all of these things too. Again, we spent a lot of time coming to this place because we wanted to be decision makers in care. And whether that's eclipsed by things like algorithmic medicine or other kinds of protocols and things that are meant to provide metrics for the hospital and make us competitive, yes, those things create opportunity for us, but they also oftentimes override common sense or reasoning that we might know and value from inside our professional experience and training. So this may make us feel, and lots of administrators may say, that they have more compliant help from nurse practitioners than they do from physicians who want to go off and do their own thing. But that also then represents a failure within our enterprise to understand what it is that we bring to the table, except when something like the COVID crisis happens and we don't have adequate treatment and we have to improvise and apply what we know, look for the results, and modify at a very rapid pace. So next, I'm just going to say a little bit about prosperity, and things shift here a little bit because things that might cause us to devote more attention or prioritize our prosperity are sometimes things that we might see as negative influences or negative values with respect to these other two domains. So things like value-based financial incentives that force us to be attentive to things that might not relate or be meaningful to these other two things, but only to the prosperity piece, are a problem. When we have reduced or threatened compensation, that also necessarily causes us to turn more emotional attention and energy at a minimum, but also maybe ideas about our productivity and stress to the prosperity domain. Compensation inequities. One of the things that's happened as medicine has become an industry is that people in the administrative or business side of things make salaries that dwarf that of a lot of the people who are at the front line delivering care. That's an inversion of how things were. And it's difficult for the people who are generating the service at an organization to feel detached from or shortchanged on the wealth being generated from that. Now, there's a lot to be said about that, but we'll put that in the equation here. And then we might also feel pressed for efficiency, that the more efficient that we can be in terms of generating more billings for a unit of time can also compromise what energy and attention we have available for these other enterprises by swelling the prosperity concerns. Now, things that might diminish the prosperity domain are having job security, knowing that we're not going to be needing to look for something new. Equitable compensation and having adequate help or support. When we have adequate help and support, that allows us to spend more time with these other things. This is another kind of compensation for our work. But when that's not working very well, then all of the effort that we're making to generate revenue is, in some respects, being eaten up by staff or coworkers who aren't contributing to our ability, peace of mind, time away from work by being efficient to address this prosperity domain. So we've talked about a little bit and hinted at the fact that there are things that happen within each of these domains that belong to the domain that can either expand or contract the amount of energy that we have available for them. But also, as this is a confluence of concerns, interests, priorities, they can influence one another. So, if we feel, for example, as happens, I think, to many people in training, that the soul journey component is undervalued and not rewarded, and that intellectual engagement maybe too isn't what people had hoped for, we get more focused on prosperity as the reward. That priority shifts, and so we can see that things move between each other as we seek in one domain or another. Or if somebody feels disappointed in their soul journey work, they might choose to go work in industry or to be in a more of a research operation so that they can at least be recovering the intellectual rewards that they hope for at the beginning of this trajectory. The final thing that I want to say about this is that each individual is going to have a different composition too of kind of where our happy space is. There are some people for whom the soul journey is almost everything, and they went and they did the intellectual training. They took that on as a way to have a seat at the table of the soul journey. And the financial part is important because you have to be supported, and you have to have enough security and resource, material resource, help, and so on, in order to have the energy to be engaged in the soul journey component, or fulfilling your sacred intention or your humanitarian goal, however you frame that. Everybody needs some of these things, or the whole thing doesn't cohere. But for another person, it might look more like this. They thought a lot about being a scientist, and then they thought, well, maybe that doesn't have enough applicability or feel meaningful in a day-by-day way. Or maybe, as it was for me, a concern that as an academic basic science researcher, you have to be on the grant cycle all the time in order to be sure that your research is funded. And that felt insecure to me in a way, in the constellation of things that I wanted to achieve. I didn't know if I wanted that piece of things to be there all the time. So there can be, maybe your formulation looks more like this. And it could be that you're somebody who comes to this with an idea that you want prosperity, like respect and money. A little part of you is interested in the humanitarian effort, or in what it means to be connected with other people. And then some measure of you is also intellectually engaged and needs something chewy to be making this money with. It has to be grounded in something. So it could look like this too. And I would submit that a lot of people end up in this configuration more not necessarily by natural disposition or inclination getting on the journey, but sort of what happens going through the training and then working in corporate medicine. So why is this important? Well, I think it's important because it's a tool both for kind of taking stock for yourself of where you are. So you can, I would suggest that you think a little bit about what this might have looked like, this pie chart might have looked for you at the beginning of your career when you were applying to medical school. And then maybe what happened in residency, and then maybe where you are now. And just see how has that shifted. Now, you might think, oh, well, this is just realistic and me responding to the outside world. And for sure, there's an element of that. But without having a little way of kind of seeing it, almost graphically, it's a little hard to understand what's happened and why, much less what we might do about it, which also to many doctors seems hopeless, but not to me. And it might also create, if you have your ideal form of it for now, even if it doesn't match what you're living and doing, it might create a way for you to evaluate the opportunities or decisions that come your way day by day in small ways, but also annually or quarterly or at major life transition points to say, how much is this matching where I need to be, where I am in my fulfilled place? And if it's not matching, how do I find out how to get it to be there? Because it shouldn't be an endurance race. I mean, we have the trifecta. We have really an amazing opportunity in medicine. And to be such inspired, intelligent, capable, motivated people, and to feel victimized by all of this is crazy. So that's all I have to say today. I hope this has been interesting and helpful. If you have comments that you'd like to leave, please do. If you are interested in learning more, you can subscribe to this channel because I'll be generating more content like this to help you think through how to be a doctor, not just what to do. And if you're interested in more help or personal transformation, you can take a look at the Metamorphosis Medicine website and see what's there. So I look forward to seeing you in a future video.